Ever wondered about the intricate workings of those twin powerhouses nestled in your chest, the lungs? Today we delve into the fascinating world of the anatomy and physiology of the lungs, so buckle up and prepare to be amazed. The lungs are not just simple sacs filled with air, they are complex, dynamic organs with a structure as intricate as the most complex piece of machinery. Each lung is divided into lobes, 3 on the right and 2 on the left, but that's just the tip of the iceberg. These lobes are further divided into segments, each supplied by its own bronchus and blood vessels. Dive deeper and you'll discover the bronchioles, tiny airways that end in clusters of air sacs known as alveoli. Imagine these alveoli as tiny balloons, inflating and deflating with each breath, facilitating the exchange of oxygen and carbon dioxide. These alveoli are surrounded by a complex network of capillaries, where the real magic happens. Oxygen from the inhaled air diffuses into the blood in these capillaries, while carbon dioxide, a waste product, diffuses out to be exhaled. Gas exchange and air movement will depend on the anatomical structures of the nose, nasal cavity, mouth, throat, trachea, conducting airways, and the lungs, which contains the alveoli and pulmonary vasculature. Now, picture the lungs as a fortress, equipped with its own defense mechanisms. The inner lining of the airways is covered with mucus that traps dust and microbes, while tiny hair-like structures called cilia move in coordinated waves to expel this debris to the throat where it is eventually ingested or expectorated. Transitioning to the physiology of the lungs, consider the process of breathing. This is a beautiful dance of pressure differences and muscle movements. Respiration involves the air movement and gas exchange in the lungs, followed by the distribution of the dissolved gases via the circulatory system. Inhalation or inspiration is an active process involving the contraction of the diaphragm and the external intercostal muscles, resulting in the expansion of the chest cavity. This decreases the pressure inside the lungs, drawing air in. Exhalation or expiration, on the other hand, is a passive process, happening when these muscles relax and the lungs recoil to their original size, pushing air out. The process of breathing varies from patient to patient and is dependent on many factors, such as age, gender, activity, and pathological issues. Therefore, we are to assess lung activity by comparing physiological or pathological differences with standardized tests that involve measurement of lung volumes and lung capacities. Understanding this anatomy and physiology aids in the development of targeted drug therapies for lung diseases. Drugs can be designed to target specific areas of the lungs. For instance, bronchodilators used in conditions like asthma work by relaxing the muscles around the bronchioles, facilitating easier breathing. Similarly, drugs used in pulmonary hypertension work by dilating the blood vessels in the lungs, reducing the pressure on the heart. Inhaled medications may also be used for systemic drug delivery, where the drug is delivered directly to the vascularized alveolar regions of the lungs. But in order to reach the lungs, the drug must avoid deposition in upper airways, such as the throat, where it would most likely be ingested. It should also deposit on the alveolar epithelium, so it can potentially be absorbed into the systemic circulation. In summary, the lungs are a marvel of biological engineering. With their intricate structure and complex mechanisms, the lobes, segments, bronchioles, and alveoli all work together to facilitate the exchange of gases, while the mucus and cilia provide a defense against potential threats. The understanding of this anatomy and physiology plays a crucial role in the development of targeted drug therapies, allowing for more effective and efficient treatment of lung diseases. So the next time you take a deep breath, remember the incredible machinery at work within you and marvel at the complexity and efficiency of your own body.